Good afternoon, and thank you for tuning in to this briefing of our community. Our interpreter for today is Francis Beaurivage, and thank you, Francis, for the service you provide to our residents. We will give you an update on COVID-19 in just a moment, but first I would like to speak about the protests and about how the city will be moving forward to address our community's call for racial equity. Our community's response to the coronavirus has been to help one another with a generosity of kindness, support, and compassion. We have pulled together to find solutions, sharing responsibility to ensure the health and safety of each resident to the best of our ability. As mayor, my priority has been ensuring the health and safety of Lincoln. These values of compassion and kindness and responsibility, alongside the greater values of equality, liberty, and justice, direct us to use this moment to address our community's call for racial equity. On Sunday, when I made the decision to institute a curfew in Lincoln, I believed at the time that it would prevent an escalation of violence and destruction in our city. I believed that many of the peaceful protesters would continue to use their voices and accept the curfew, allowing us to keep them safe from harm by the bad actors taking advantage of this moment to cause violence and destruction. As a white person, my lens on the world prevented me from recognizing how the use of curfew could foster mistrust and increase tensions. On the first night of the curfew, both protesters and law enforcement felt threatened and suffered injuries. In the days since, law enforcement, the peaceful protesters, and I have learned and evolved. Our officers have demonstrated their commitment to ensuring that our protesters can be heard and remain safe. And at the rallies I have attended night after night, I have heard organizers demonstrate grace and leadership by calling for peace. This shared commitment to peaceful dialogue gives me a lot of faith that there is a way forward for our community. Each of us must listen, learn, and act. I have heard from hundreds of residents this week who want to see these protests result in positive change. Many have shared with us the 8 recommendations rooted in the findings of the Task Force on 21st Century Policing, which has influenced the thinking of cities across our nation. Our Lincoln Police have already incorporated many of these recommendations into their policies, and here to provide more information on that is Chief Jeff Bleimmeister.
Thank you, Mayor. And we, the Lincoln Police Department, the men and women of our organization, are very familiar with the concepts that are rooted in the documents brought forward from President Obama's 21st Century Policing. We are committed to a robust review of our policies, which we do on an annual basis and as case law or other legislation changes. But in addition, this is an opportunity. This is an opportunity going forward to take an even deeper dive, looking at it from a new perspective to apply these concepts to our existing policies, procedures, training, and quality assurance measures. Each time there is a use of control, there is a complex review process in place. This has existed for a long time and is critical to ensuring the transparency and the appropriate use of force. As we reflect on the last week and the optimism and the hope that I have based upon the last few nights of peaceful demonstration where voices are being heard and there is not violence and there is not property damage that has been associated with it and there's been no injuries to officers or protesters, I know that we have had a strong relationship in our community between the police and the community, with the police and the community. But I do know, as do our staff, that this is another chance to strengthen those relationships. And you have my commitment on that going forward. Thank you.
Thank you, Chief. Our Lincoln Police embrace transparency and are proud to hold themselves to the highest standard. I commend the initiative of community leaders who are working with LPD to ensure that these standards are the lived experience for each of us. In the coming days, we will be taking a number of steps to address the concerns of our residents and strengthen accountability. As a next step, we will be reviewing our use of force policies. We must ensure that these policies are in line with our number one priority as a city, which is to keep everyone in our community safe. Additionally, we will re-examine the ordinances that govern our existing Citizen Police Advisory Board and seek to incorporate any additional best practices that could further ensure a robust process, including the accessibility and manner in which complaints are received. We will be partnering with people across our community to create listening sessions with community leaders, elected leaders, and residents to increase a shared understanding of the specific issues of inequity in Lincoln. There will be multiple sessions, one of which was organized and hosted by the peaceful protest leaders at the Malone Center earlier this afternoon. Additional listening sessions are being organized throughout Lincoln by various organizations in multiple formats and venues in the coming days. These efforts will include conversations with my Multicultural Advisory Committee members, a dedicated and important group of community leaders who help guide our city. Next Friday, June 12th, over the lunch hour, together with Chief Blymeister and Councilwoman Sandra Washington, I will be holding a listening session by Zoom with the goal of hearing from many residents. This will be the start of a conversation about where we are today and where we want to be in the future. More details will be available on that soon. Finally, we are committed to coming back to you by the end of June with more concrete steps demonstrating the city's responsiveness to our community's desire to walk together towards equity, kindness, civility, and justice. And now we will turn to our update on COVID-19. We want to remind you that a great deal of detailed information can be found on our website at covid19.lincoln.ne.gov. We unfortunately begin our situation update with news of another individual in our community who has passed away from COVID-19. This is the 10th death in Lincoln, and our hearts go out to all of those who are feeling the pain of these losses. We feel that pain too. We are here to update you as well on our COVID-19 risk dial. It's been in place for a month now. This simple tool helps our community know what actions and behaviors each of us can take to protect ourselves and each other and to protect the health of our community. The COVID-19 risk dial provides a visual, color-coded depiction of the conditions here in Lincoln relative to the pandemic. Red represents highest risk of COVID-19 spread, and green represents the lowest. For each color of risk, we provide specific recommendations for physical distancing, face coverings, hand washing, self-monitoring for illness, and disinfection, both when all of us are outside our home, at work and in public, and for when we are at home. And we update the dial each Friday based on local data to estimate how high that risk of spread of COVID-19 is right now. The health department team has determined that the risk of spread of COVID-19 in our community has decreased. And for the first time, we will be moving from the high-risk category of orange into yellow, which is the moderate risk category. The reason for this is that our indicators have improved. I want to emphasize that while the dial has moved, the risk of COVID-19 spread in our community is still a concern, and we need to continue to take actions to reduce the spread. If we remain vigilant in our efforts to maintain 6 feet of physical distance from others, wear face coverings, wash our hands regularly, and stay home if we are ill, we may continue to make progress in the right direction. Health Director Pat Lopez is here, and she will now provide more information about these indicators and explain how this determination was made.
Thank you, Mayor. The Health Department continues to use local and regional data from the past few weeks to determine how high the risk of spread of COVID-19 is in our community. This is an update on the main factors. For the first time, we have seen 3 consecutive weeks of decline in the average number of weekly new COVID-19 cases. Today, we reported 17. In review, the 7-day rolling average has dropped from 39 cases at the beginning of May to 15 cases at the beginning of June. This indicator has improved. Another factor we consider is the positivity rate, the overall percentage of all tests that are positive. The overall rate is shared every day because this gives us a more accurate account and a look at the overall trend. The daily and weekly rates are also reviewed and provided on the dashboard for more of a snapshot view in time. This indicator has also decreased each of the last 3 weeks, from 9.2% on May 15th to 7.4% today. As a comparison, the state rate is at 13.1%, and the national rate is also currently at 13.1%. This indicator has also improved. Our local testing capacity continues to be good. Adding Test Nebraska on May 8th to the existing hospital testing and drive-through sites, we were able to complete nearly 12,000 tests in the month of May alone. However, this week we did see a decline in the number of tests completed and do anticipate a leveling off or decrease in the number of tests being completed due to Test Nebraska reducing the number of days operating in Lincoln for the next few weeks. But there is still capacity, and we strongly encourage people to sign up to get tested if you have symptoms of COVID-19. To get started, you can contact your doctor or fill out a risk assessment at chihealth.com or bryanhealth.com. This indicator also is considered stable. A fourth indicator is the capacity of the health department to conduct investigations and complete contact tracing. As we have shared, this indicator is considered flat. Our capacity to do contact tracing exceeds the current demand. The fifth major factor we consider is the capacity of our hospital and our entire health system. To determine this, we look at the total number of patients hospitalized, the number that are COVID-19 positive, what our protective equipment needs are, and the availability of ICU beds. Overall, hospital capacity remains strong. We did see a leveling off of COVID-19 patients in our Lincoln hospitals over the past 2 weeks. Today, our local hospitals report 36 COVID-19 patients. That includes 18 from Lancaster County and 18 from outside of our community. 4 of those patients are on ventilators from Lancaster County, and 4 are community members from other counties. This indicator is healthy and steady. Finally, we considered the number of deaths. Unfortunately, we know that deaths will occur with this virus. Each of these deaths is a member of our community, and losing the lives of our most vulnerable residents is the most sobering aspect of COVID-19. As the mayor said, we have experienced a total of 10 deaths in Lancaster County since April 8th. Thus, taking all of these key factors into account, the health department team has recommended we move the dial down to the highest yellow level, which still means the risk of COVID-19 spread is moderate. We do so very cautiously and in hopes that everyone will understand that this progress can be lost more easily than it has been gained. This is good news. We are moving in the right direction. However, there is still concern as we go forward. There is caution because the virus still may increase its impact in Lincoln. As the directed health measure eases, people become more active, maybe begin to host small gatherings with friends and family, and attend smaller outdoor events. There will be an increased potential for exposures opportunities in the community. And just as there is concern across the country, we too must be careful that large crowds gathered during local protests do not intensify the spread of COVID-19 in Lincoln and trigger a potential outbreak. Close contact in crowds and being shoulder to shoulder for prolonged periods of time does increase the exposure risk for COVID-19. We also need to consider what is happening regionally. And Omaha has seen an increase in cases the last 4 consecutive weeks, an increase in hospitalization, and even worse, more deaths. We are in communication with Douglas County Health Department on a daily basis and will continue to monitor their situation closely. We have consistently shared what we must do to lower the risk of COVID-19 in Lincoln and Lancaster County. Physical distancing, wearing a face covering when around others, and washing our hands frequently. Evidence for supporting these recommendations was just published in The Lancet. This is a peer-reviewed medical journal. The findings were drawn from a systematic review of 172 observational studies across 16 countries and 6 continents. It provides the best available evidence that current policies of physical distancing and wearing face masks are associated with a large reduction in infection. It showed a reduction in risk of 82% when physical distancing. This evidence is important to support the recommended guidelines and shows risk reduction is feasible just by physical distancing. These data also suggest that wearing a face covering protects people against infection by the COVID-19 virus. Findings showed the use of face masks can reduce the risk of respiratory virus by 80%. To be clear, we need everyone's commitment to protect one another for us to stay within the yellow, a moderate risk level, to hopefully move to green. And specifically for adults over age 65, anyone with underlying health conditions or other populations at high risk for COVID-19, please stay at home as much as possible. Rely on help for needs outside the home, such as groceries and medication, and distance yourself from others when you're outside. Lincoln deserves a big thank you, and Public Health wants to thank you for being engaged in this pandemic response and helping the community to continue to move forward.
Thank you, Director Lopez. You and your team at the Lincoln Lancaster County Public Health Department deserve a huge thank you from all of us, and I echo your praise of our community who have done so much, undertaken so many steps to get us to this point in the pandemic. As many members of our community are making their calls for racial justice heard by taking part in rallies and protests, as Director Lopez said, we do want to encourage those who are participating to wear face coverings and to engage in physical distancing to the extent possible. If you have taken part in these protests, you may be eligible to receive a test for COVID-19 through testnebraska.com. We encourage you to visit that website and fill out a risk assessment to see if you qualify. And with that, we'd be happy to take any questions from the media.
Kent Wolgamott from the Journal Star here.
Hi, Kent.
Hello. Obviously, addressing the policing is of forefront at this moment. But do you plan in these listening sessions and task force to really look at the systemic racism that's been incorporated into American life, essentially, housing and employment and all of those aspects, and how that can be addressed in Lincoln as well?
Yes, Ken, thank you for acknowledging how this isn't just about City Hall. It isn't just about the police department. It is about culture in America. And I think that the conversations we need to be having, really are around to what extent are we taking up space that belongs to other people? As white people, are we taking up the space that a black person could otherwise have? To what extent are we diversifying our workforces? To what extent can we be part of solutions that create more opportunity in America for everyone, in our healthcare systems, in our schools, in our neighborhoods, the way we plan and design neighborhoods included? So yes, this is a much larger conversation that all of us need to be having, and it starts with this profound moment of awareness, some people just coming to the conversation for the first time. And I encourage all of you who want to do something to take it upon yourself to learn, to read, to educate on how you can be part of a solution and allow yourself that vulnerability. No one's perfect. No one's going to get it right the first time. But the effort and determination to make progress and to be committed to creating a more just and equitable world and showing compassion and true intention of care and kindness is going to go a long way. And it's where we all want to be.
from your first remark, do you have some regret about issuing the curfews?
What I would say, Kent, is at that moment, in that moment in time, with 2 nights of massive violence and destruction, fires burning in buildings, glass broken, people getting hurt, we had to make a quick decision. I had to make a quick decision. And mayors across the country, over 40 mayors imposed curfews. This is a tool. This is a tool for controlling crowd sizes. And that was the thinking. That was my thinking. And, I came to that with the lens of being someone who follows the rules and is rewarded for following the rules. And that's not necessarily the experience of everyone in America. And for peaceful protesters, being in harm's way was a sacrifice they're willing to make. And we learned from that. We learned from that first night of curfew much more than we knew going into that first night of curfew. And we adjusted and evolved. And I hope everyone feels the positive results that have come from the way that we have adapted our strategies. And I hope we can really acknowledge the leadership of the young people who were in harm's way, who have called consistently for peace, and who are really working to make sure that those who attend their rallies know that it's unacceptable to engage in any form of violence, despite the rage that they feel justifiably at the unequal treatment of some people in our country.
As you've attended these rallies, what have you heard from the protesters? What is the sort of feedback's not really even a good word here. What are they? Is there anger towards the government, towards you, towards the city, or is it, what have you heard?
All of Kent. There's a lot of anger. There's a lot of pain. There's a lot of fear. There are a lot of young protesters. A lot of these kids are 17 years old, and their parents are really stressed out and worried about their safety. I've heard kids talk about being treated unfairly in the schools, in their discipline. I've heard again and again the call for people to understand that everyone needs to acknowledge that Black lives matter. And that in no way takes away from other people's lives mattering. But we need to acknowledge that Black lives matter because for too much of our 400-year history in America, Black people in America have been treated as less than human. And that is what the video of George Floyd's callous and brutal killing demonstrated to so many in a way that maybe they hadn't been able to see before. And the kids in our community and the people across, adults as well, and people across our country are really, they just want to be recognized as human beings and have the full potential to flourish that any of us want for ourselves or our children.
Mayor, this is Bill with 1011.
Hi, Bill.
Do you envision a question, whether it be with Test Nebraska or even CHI or Brian, that if you were a part of protests, that would then qualify you for COVID-19 testing?
No, I don't. But what I do know is that Test Nebraska has expanded the age range of eligibility. So if you fall between the ages of 15 and 35, you now are able to more easily get access to a test, not just on that basis alone, but in the past, the priority for testing fell to older age groups. And now what we're seeing is that a high proportion of people who are testing positive for COVID-19 are actually in that 15 to 35, or in the sort of middle to younger age bracket. So we want to encourage anyone who thinks that they may have symptoms or been exposed to go ahead and fill out that risk assessment and see if they would be eligible at testnebraska.com. Other questions?
I have a question or two for Director Lopez.
Okay, and I'll just follow up on your question too, Kent. When you ask me what I'm hearing, I'm really happy to try to amplify those messages, but I encourage everyone to tune in to the live streams of media coverage so that you can hear it for yourself if you're not someone who wants to go down there in person, because these are strong and powerful voices that ought to be heard on their own terms. And I don't want to say that I speak for them. They speak beautifully for themselves. And now Director Lopez will come up.
I can't.
Two things. One's pretty quick. Do you have the information on the individual who died, age, sex?
Yeah.
That
Sure. It was a male in his 90s, and he had been hospitalized for a period of time.
Thank you. Have you looked what factors really were the key to the drop in the? I understand what you laid out. Is there any specific thing like a reduction in the amount of cases from Smithfield or something like that really helped to trigger that drop in the warning gauge?
Yeah, I think part of it's due to the fact that we've had more testing available, so we have a better idea of prevalence. And the other thing is that I think we've really been able to do an excellent job in actually exceeding what needs to be done for contact tracing and being able to really work. And it's not only being able to do that, but it's also for our community members that we're in touch with, that we're monitoring and assisting, are really following the recommendations. That's really what's helping us mitigate the spread.
Thanks.
Any further questions?
I have couple questions from Channel 8. Brent wants to know, what is the status of the city's state of emergency? Has it expired now that there is no curfew?
The question is, what is the status of the city's state of emergency? Well, to be honest, we had two of them at the same time, so we're still in a state of emergency based on COVID-19. Regarding the protests, and because I believe that has expired, yes, that has expired. Other questions?
I have one for
Okay, one Director Lopez, she'll be right here.
This is also from Channel 8. The Two Rivers Health Department confirmed a case of multi-symptom inflammatory syndrome in Dawson County. Is Lancaster County monitoring that syndrome, and are there any suspected cases locally?
Yes, the question was about multi-systemic syndrome. This is something that's been impacting children. You may have heard this nationally. It's been on the news. And one of the other local health departments that covers Dawson County has reported a case there in a child. We are monitoring that continuously. And actually, we did a briefing with the physicians in our community. One of our pediatric hospitalists provided information to them about warning signs and alerts. So every health department across the state is monitoring for that.
I have another for Chief. This is from Channel 8. Can you reiterate what you said in the morning police briefing about shots being fired at the Hall of Justice?
Yes, the question is from Channel 8, asking me to repeat what I had acknowledged this morning in the morning press briefing for the police about shots being fired. And what I demonstrate, or what I talked about, was the fact of as the calamity and chaos has slowed down, we're able to know exactly some of the things that were happening. And included in that, we have confirmed that shots were fired and did damage to the Hall of Justice. We do not know the source of those particular shots, but we know that it occurred while Lincoln police officers, Nebraska State Patrol members, and members of the Lancaster County Sheriff's Office were in front of the Hall of Justice. That investigation is ongoing.
Any further questions from the media? All right. Thank you for tuning into this community briefing. We hope you have a safe and healthy weekend. Take good care.